Imagine a simple blood test that could reveal the earliest signs of liver problems, sometimes even before you feel a single symptom. The ALT blood test is one of the most important tools doctors use to catch liver issues early, helping you stay healthy and one step ahead. ALT stands for alanine transaminase, an enzyme mostly found in your liver. Enzymes like ALT act as catalysts, speeding up vital chemical reactions in your body. Under normal circumstances, only a small amount of ALT circulates in your bloodstream. But when your liver cells are injured or damaged by disease, infection, or even certain medications, they release more ALT into your blood. That's why higher than normal ALT levels can be an early warning sign of liver trouble, sometimes before you even notice something is wrong. Doctors often order an ALT blood test as a routine part of a checkup, or when you're showing possible symptoms of liver damage. These symptoms can include nausea, vomiting, fatigue, weakness, a loss of appetite, yellowing of the skin or eyes, known as jaundice, swelling or pain in your abdomen, swelling in your ankles or legs, dark urine, pale stools, or frequent itching. Even if you don't have symptoms, your doctor might order this test if you have risk factors like family history of liver disease, alcohol use disorder, obesity, diabetes, exposure to hepatitis, or if you're taking medications known to affect the liver. The ALT blood test itself is quick and straightforward. A healthcare professional will draw a small sample of blood from a vein in your arm. You might feel a brief pinch from the needle, but the process is over in just a few minutes. In most cases, you won't need to do much to prepare. But if your doctor has ordered other blood tests along with the ALT test, such as a comprehensive metabolic panel, you may be asked to fast, meaning no food or drink for several hours before your appointment. Always tell your provider about any medications or supplements you're taking, because some can affect your test results. But don't stop any medicines unless your doctor instructs you to. There's very little risk involved with the test itself, aside from minor pain or bruising at the needle site, which usually goes away quickly. The real value of the test comes from what it can reveal about your liver's health. After your blood sample is analyzed, your provider will look at your ALT results along with other liver function tests. A lower than normal ALT level is rare, but could be a sign of a vitamin B6 deficiency or chronic kidney disease. And your doctor may want to run additional tests if this is the case. More commonly, a higher than normal ALT level indicates some form of liver damage. The causes can range from hepatitis, infection, cirrhosis, liver cancer, and other liver diseases, to a lack of blood flow to the liver, certain medications, or even exposure to poisons. It's important to remember that an abnormal ALT result doesn't always mean you have a serious medical condition. Age, sex, weight, diet, supplements, and even strenuous exercise or your menstrual cycle can all affect your ALT levels. That's why your doctor will interpret your results in the context of your overall health, your risk factors, and the results of other tests. The ALT test is often performed alongside another liver enzyme test called AST. Together, these tests form part of a liver function panel, giving your provider a more complete picture of your liver's condition. Because ALT is found mainly in the liver, its levels are particularly useful in detecting liver-specific damage, whereas AST is found in several parts of the body. One of the most powerful uses of the ALT test is its ability to detect liver problems before symptoms develop, allowing for earlier intervention and treatment. Some liver diseases can be managed more effectively when caught early, potentially preventing long-term complications. The test can also help your doctor monitor ongoing liver conditions and track how well treatment is working. If your ALT test shows abnormal results, don't panic. Many factors can temporarily raise or lower ALT levels. Your provider may recommend repeating the test, ordering additional tests, or making lifestyle adjustments to see if your liver health improves. In some cases, lowering your risk for liver damage by managing your weight, avoiding excessive alcohol, controlling diabetes, and being cautious with medications can help bring your ALT levels back to normal. To sum up, the ALT blood test is a simple yet powerful tool for monitoring your liver's health. By measuring the amount of ALT in your blood, it can help detect liver damage early, guide further testing, and help your healthcare provider determine the best approach to keeping your liver, and you, as healthy as possible. If you found this information helpful, don't forget to like this video, share it with your friends, and subscribe to the MediByte channel for more great health tips and knowledge. Stay informed, stay healthy, and see you in the next video.